In 2022, a new chapter in Embu County's history began. It was time for Honorable Cecily Mbarire, the governor of Embu, to turn her promise to residents into reality in the healthcare sector. More than a century later, County number 14, that is Embu County, has carved its own niche as a trailblazer in healthcare delivery. In the next 14 minutes, we take you inside a transformation that is redefining health in Kenya, from the state-of-the-art facilities in the most remote villages to a fully functional digital management processes that are making public hospitals as efficient as any other hospital in the world. This journey began in a crisis. Not long ago, Embu County made headlines for all the wrong reasons. Hospitals struggling with shortages, lost resources, ballooning deaths, and neglected public spaces.
One of the most critical sectors that was highlighted greatly in my manifesto was the health sector. You'll all agree, by the time I was coming into office, the health sector had very major challenges. And some of the challenges, we got to know even more about them once we got in. And the first thing I did was to establish a task force to look into the health sector and tell me what challenges were there and what we should do to deal with those challenges. Of great concern to us at the time was, number one, is that the health sector was almost dead. And how was that the case? Because one of the biggest challenges was that we did not have adequate supplies in our hospitals to be able to deal with the cases that were coming. So we did not have enough drugs, and even when they were there, they were in they were not regular in terms of supplies. Even non-pharmaceuticals were not available. The stores were empty. And so one of the things that we looked at was, how do we ensure that there's a steady supply of pharmaceuticals and non-pharmaceuticals in our hospitals? And we had to get into a good partnership with KEMSA, which at the time we had serious pending bills with them. We owed them well over 100 million, and other medical suppliers, none wanted to supply to Embu County because of pending bills. So we went out of our way, ensured we financed the health sector by providing adequate resources through the budget, and were able to pay most of the pending bills, if not all. As a result, KEMSA was now comfortable to continue to give us the much needed medical supplies by way of pharmaceutical, that is drugs, and non-pharmaceuticals.
We have made quite a number of strides here as a Department of Health. I was blessed to be among the task force members. So when I came to this department, I was privy of all the problems and the challenges that existed, since I was among the people who had drafted the task force report for excellence. So one of the biggest battles that have been in this department for the last 11 years was the passage of the Embu County Health Services Act. That I took as my biggest challenge and the savior for this department. So within the past 4 months, we have already enacted into law the Embu County Health Services Act, which among many issues brought transformation to this department. It ring-fenced all the revenue collected from the department to stay here in health. And for the first time, we were not very, very constrained in terms of resourcing at the health department. We also had a lot of challenges with the HR. We had very demoralized staff across the board for various reasons. One of the most major reasons for the career progression, many had stagnated for close to 10 years. So in our discussions with our HR, we first onboarded the team that had stagnated for quite some time. And we looked at all the ones who had not gotten any promotions 7 years and above, and we made effort to promote them. We also ring-fenced any HR remuneration from the officers who are retired to cover recruitment of new officers, and that is still ongoing. So I can say that we have made quite a number of strides in the terms of the relationship between the department and our HR, and we will continue improving it as time goes. So in the Embu County Health Services Act, another major issue was the governance structures of our facilities. We already now have new boards for the level 5, the level 4s. Vetting is ongoing for level 3s and level 2s. So that is also one of the biggest issues that really pulled down service delivery of our facilities. So we have tried to report consistently to our counties and to the government and the assembly all the steps that we are taking as a department here in health. So I can say that with a lot of conviction that we are in a much better place currently, and we are working very well as a team to improve service delivery.
Like a well-run corporation, the county health department can now monitor every member of its staff, track every drug, and account for every piece of equipment within a click of a button. This transparency prevents wastage, misuse, and theft, and the results, they are tangible.
Yes, digitalization is key for our health management information systems, and I'm glad to say that our level 2s and 3s are all digitalized as of now. So that's around 99 facilities are all now using tablets that have been supplied through the Digital Health Agency, the Ministry of Health, and so that now we are having all our systems being digitalized, all the way from registration to the lab to the pharmacy, and so we are waiting. Level 4s are due for digitalization this month of August, and then we'll wait for the level 5 after some time. So this is smooth operations, because even reports will be generated easily. You have the backup that is now going to be at least more secure as opposed to maybe the manual systems. So that is something that the whole National Ministry of Health is doing in all counties, and Embu County was the second to be rolled out after Mombasa County. Also, with the coordinated efforts of public health in the improving of sanitation, as well as our routine immunization coverage, we have noted that cases of pneumonia and diarrhea in the under 5s have gone down. And those are one of the top 5 killers of under 5 in the country. So with that reduction, that really is helping to improve our under 5 mortality rate, which is embedded in the Sustainable Development Goals.
Behind the numbers is a simple truth: prevention is always better than cure.
In Embu County, we have CHS session and Department of Health in Embu County, whereby we have 1563 CHPs, that is community health promoters, and we have 55 community health assistant, that is CHAP. Each CHPs, they serve 100 household, whereby each household has five members of household, whereby they serve in a population of 500. per village. With CHPs, we have several activities we undertake currently. We are doing community screening. Since we started this program for community health promoters, we have seen the increase of service delivery in utilization of medicine at the household level, and also the home deliveries, whereby we are very actively doing the activities at the household level. And we have the following activities we normally carry at the household level. We do community screening on BP, that is blood pressure. We do blood sugar, and also we use MUAC tape to assess the malnutrition at the household level. Then we do health the status profiling, whereby in every household they visit, they have to profile status of health for every individual in that household, whereby in case they see any problem for the individual profile, we refer to the ring facility, where the unit is linked.
Yes.
So, and also we really embrace the health workers, because nowadays, before we started the community health services, we could not be able to have the referral linkages to the facility because we had no system.
A strong community health policy, vigilant disease surveillance, and a commitment to clean towns and environments have been key.
Our core duty is to make Embu clean. We start very early in the morning. Our cleaners start at around 6. This is one of our very busy transfer station within the CBD. We normally correct here twice in a week. In fact, we have around 34 bins which are mounted across our county. We have waste. It is taken to our final disposal site, which is Kagonga. We are trying to keep our town as clean as possible. We normally correct waste about 40 tons in a day.
This is the bucket which we normally use to load our lorries. This backhoe was acquired through the effort of thing prohibited. This was the year 2023. Before then, we had a small one.
This one, it can be able to load all the vehicles within a short time.
This is one of our very good vehicles. It's a compactor. It compacts with so it can carry a very huge load. This is the final area where we bring our waste. As you can see, the perimeter wall will assist in controlling the dump site, so that no entry after 5. Once it is closed, nobody, mostly private correctors, they will not enter into the dump site, because these are the people who normally dump the waste which is not supposed to be dumped here, especially the healthcare waste. We have some people, some families who normally make their livelihood through doing sorting of the waste. They normally do it, then they sell for recycling. We encourage sorting out of the waste from the source, segregation. That is, we segregate the garbage, what can be used and what cannot be used before it is brought into the dump site.
Another secret weapon has been public-private partnerships, expanding access and quality without stretching the county's budget beyond its limits.
And if I can be able to give a picture of what the department through their staff or through the staff has been able to collect, 2023, 2024, 2025, 517 million from in comparison with the 2023-2024 collections of 341 million. So this one translates to an increase of 108% of revenue collections by the department. Through the replacement of the health workers that have been able to leave the service, either through resignations, through natural attrition, the department has worked on ensuring that we do timely replacements so that we be able to address the gaps that have been left by the officers that are leaving the service. This has led to a number of officers being recruited in the service, and it's my belief that it has also led to motivation of the care workers.
In some places, mobile phone signal is unreliable, but access to quality health care is not. The KURIA Health Center stands as a proof.
On the other aspect of the department and the county government is in the infrastructure development. And as you are aware, the county government through the department has enhanced service delivery through provision of improved structures, that is dispensaries level 2s. We have the centers which are at level 3s and also level 4 facilities. And for example, when you visit a facility like KURIA Maternity, you find that it's one of the modern facilities that we've been able to get through our partners and the collaborations of the county government, whereby our mothers have warm water to get a bath, and also it is a facility that has a water purifier. This ensures that the water that is being consumed in that facility is well and good for consumption. Also, our maternity in Kedemo, which is also solar powered, whereby we have warm water for mothers. And also Kianjokoma, whereby right now through our partners and the county government and Safaricom Foundation, we are building a mother and child block, which will also enhance service delivery and also maternal care to our mothers. It is also in that Kianjokoma whereby the county government is planning to uplift it or to upgrade it to level 4 so that it can give services well to our people. Together with Kategi, whereby already we are doing a maternity, which is mother and child block, and also Kirikiri, which we are also completing our theatre and the radiology departments. So it is our belief that once these facilities are fully upgraded and renovated and fully completed, they'll be able to give services to our people.
And on disease surveillance, I would say that we are one of the counties that is doing very well in terms of disease surveillance. We do what we call community-based surveillance through our community or the promoters, and in case of and also at the facilities. In case we have a facility whereby there is an increased abnormal health events. For example, you may find people on diarrhea, which are abnormally. Then at that level, we do the disease surveillance at that level, whereby in such an event taking place, we have teams. We have a county team that handles disease surveillance, and also the sub-county team, which also handles the same. So once we have such a kind of a case, it is normally reported. And our county team normally goes down, teams up with the sub-county team, and goes to the ground to handle the situation. Early this year, in January, we have a case of anthrax in Runyenjes, which actually was reported by our CTPs, and our team went very fast to the community, and we were able to disinfect that place, and also the meats that had not been inspected, it was buried. That is, it was thrown away, it was buried. So basically those are the two channels that we normally use when it comes now to the disease surveillance. At the same time, we take advantage of the public balances so that we create awareness to the members of the public on the dangers of eating the meat that has not been inspected. That has really helped us, because the whole idea, as far as our department is concerned, is preventive. So basically that is how we handle disease surveillance.
And the transformation isn't just about physical illnesses. Mental health, once overlooked, is now firmly on the agenda.
Yes, for mental health, as we have all seen, it is a growing need or burden in our country, with rising cases of depression, suicide, and the like. Our Embu Level 5 has a dedicated psychiatry unit that offers outpatient services Monday to Friday, 8 to 5, as well as inpatient care for both male and female patients with mental health conditions. We have a psychiatrist stationed there at Level 5, as well as a number of the auxiliary staff, the psychiatry nurses, psychologists, to help with giving the care these patients needs. And also our pharmacy has been now well stocked with the modern drugs for psychiatric care that have less side effects. So Embu County is taking mental health the seriousness that it deserves. Also, as another pillar for health systems is what we call the health management information system, which that's where we, and also the health finances, as I mentioned, that's where SHA comes in, which is Social Health Authority that replaced what used to be called NHIF. So for Embu County, we are 7th right now currently in the registration of the households. Around 54% of the households are registered. And that is with the great help of the CHPs, as well as the facilities, health facilities where one may register for SHA. And the registration of SHA is of great benefit in terms of reimbursement for the primary health care fund for our level 2s, our 3s and 4, which are able to claim for services offered, including maternity services, and level 5 as well for the inpatient services and the level 4s. So for the level 2s and 3s, the greater the number of households registered, the greater your allocation for the primary health care fund. So that is why we are really keen on that SHA registration for all in our county.
None of this would be possible without the network of partners, both local and international, who have walked this journey with Embu County.
So I want to take this opportunity to thank sincerely all the partners who work with our department to make sure that we bridge the budgetary gaps, we bridge the divide between where we are and the service provision we envision for our people of Embu County. I want to thank in particular Jamii Tekelezi. They have really empowered our TB HIV programs. I want to thank VIP for the Fred Hollows and the Fred Hollows Foundation for the eye programs across the county. I want to thank APDK and CBM for the Disability Access Program. I want to thank the Kenya Society for the Blind, the Kenya Red Cross Society, the St. John's Ambulance, MIRI, KEMSA Global. We also, in a very special way, thank the partners who work with us in the mental health department. We have Nutrition International, who have come in handy to help us improve our nutrition across the county and bring down the disease burden. So I have worked also with KEMRI. We have worked also with Beyond Zero Foundation. We have worked with MIRI, with Global Fund, AMREF, and all of them have been very, very instrumental and very handy in the success of our programs. They have been very helpful, because as a county, we are cognizant of the fact that we are not able to bridge all our budgetary gaps. So any partner who comes on board and helps us walk this journey together, then we are very, very grateful to them. We know many have shown interest. We recently signed an MOU with the University of Embu, and we plan very many joint programs together. So kwa hayo machache, asanteni na safari tunatembea pamoja.
Because we must give services to the people of Embu County.